currently working with COM and also some of the partners in Pakusi la Moyo. That Gladson has just done an excellent presentation describing the program Pakusi la Moyo in Malawi in Mchinji. And we are working together with the local partners and COL to see whether we can evaluate the program on a larger scale. So first of all, you might say, why do we want to evaluate a program? Why would we do this? And firstly, it's to demonstrate an impact. That's one of the key questions that everyone's been asking. How do we know we're having an impact? Also, if we can demonstrate that a radio program is having an impact, we could use that knowledge to encourage investment from funding organisations, from NGOs who might want to use the radio station to communicate their messages, and from other commercial organisations. If you can show that a radio program is reaching people and influencing people in the way they think, then that would also potentially attract private organisations to advertise as well, which could be an income revenue for community radio stations. If we can demonstrate that there has been an impact, we can use this information to convince policymakers. We can scale up successful models for radio programs. So if we can show this model works really well, such as Pakusi la Moyo can say, this is a really good program, could we not replicate this program elsewhere? And also, we've discussed community media as a concept and communication for development. And if we have more evidence to show that it can make an impact, then it can in some way legitimize the discipline or further legitimize the discipline. So the Pakusi la Moyo program, they currently do a lot of gathering of evidence, particularly qualitative evidence. So they have feedback forms from the radio listening clubs and feedback to producers. I'm sure Gladson's heard lots of feedback from the women's groups themselves, from the listeners themselves and all the partners involved. There's also the perception, perception of the hospital, that more women are attending the clinic because they've listened to the program. More husbands are attending clinics with the men because they've listened to the program. And more women are getting tested for HIV. And this is qualitative evidence, which is very useful. But what we are trying to do is to see whether we can prove or demonstrate that the program's having an impact in a more robust way. So I'm currently at the stage working with COL and local partners, Maimoana, to see whether or not we can use quantitative data to show whether or not the Pakusi la Moyo program is having an impact on care-seeking behaviour or maternal health in the district. And I'll just run through this in terms of this is some of the process that we're going through. So first of all, we're thinking, what is the research question we're trying to ask? What questions do we need to ask in order to demonstrate that the radio program is reaching people and is having an impact? So the first question is about the program itself. Can we show that or can we find out using data whether or not the program is reaching enough people and is meeting their expectations? So it's covering enough people and is reaching their expectations. So this is the way we have phrased it currently, which is what is the quality, which means the coverage, how many people it's reaching, and fidelity of the implementation of the program. So fidelity is about whether it meets their expectations. So has the program, so the listeners, when they listen to the program, is it meeting their expectations in terms of, are they listening, are they hearing what they want to hear? Is it a good quality program in their eyes? The next question is, has the implementation of the program resulted in increased care-seeking behaviours in exposed populations? So this is whether or not, when they become pregnant, whether are they seeking out the hospital, are they going to hospital to get checked up? Are they attending hospital for antenatal clinics? Are there any of these behaviours that have changed since the program was introduced? So by asking, this is a key question that we're going to ask, and we'll be looking at the data that we've got to find out if any of these care-seeking behaviours have changed since the introduction of the program. And we're looking at care-seeking behaviours and care behaviours. So one area is care-seeking, so where they're seeking out, they're attending clinics, they're asking for health care, and another one is care behaviours, so whether or not they're using bed nets, for example, to avoid malaria, or whether they learn about how to prevent cholera, and whether or not they're adopting those behaviours. So we're now moving on to a study design, and I think there's too many words on these pages, and there's too many words on those pages. So I'm just going to, we're moving towards a study design. We are very lucky in this case because there is already a lot of data available. So in my Moana, the project that started the women's groups that Gladstone referred to, have already been surveying the population for the type of data that we need, so healthcare seeking behaviour, attendance to clinic, whether or not people are using bed nets. And so we are able to use some of that data from the year before the programme started to see, and use that as our baseline data, and then assess whether or not these measures have changed since the programme has been introduced. And crucially, we are hoping to find an exposed population, so populations of the district which received the radio programme, and compare that with populations of the district that didn't receive the programme. So by comparing those two populations, so it's almost like a control population and exposed populations, we might be able to determine whether or not the radio programme has had an impact on some of these care-seeking behaviours. I mean, it'd be important to control for some of the other interventions that are taking place in the area, maybe natural changes that would have happened anyway. So that is the difficult part, is to try and control for the natural change and the other interventions in the area. But this is what we're planning. So I think the purpose of this, my presentation, was just to talk a little bit about how we've gone about planning that and do an overview of this proposal, which is a research proposal that we're drawing up at the moment, about how we're going to measure the impact of Fukusi Lamoya, which is what Gladstone was telling us about earlier.